Now today we'll be looking at what poor posture is. Poor posture is any position where your body isn't aligned in a natural and efficient way. Talking of poor posture, some of the examples we have include the forward posture, the rounded shoulders, the hunchback position. We have the anterior pelvic tilt and the posterior pelvic tilt. All these affect how your vital organs like the heart, the lungs, and the brain function. Now let's look at how it affects the heart. Now the slouch that you may be having may cause the chest wall cavity to collapse, thereby putting pressure on the diaphragm and the chest wall cavity and the chest wall will increase. Now what happens with this? There will be decreased blood flow, there will be poor circulation to the body, and the blood pressure might increase due to the increase in the vascular compression. Now all this, as you see together, will impact and affect the entire body system, since the heart is the pump to the body. Talking of the lungs and the breathing, now the rib cage will compress, and as the rib cage compresses, there will be reduced space for lung expansion. Now talking of lung expansion, I mean the chest wall movement. Now what happens after this has occurred is that you will have shallow breathing, you will have lower oxygen intake, you will have fatigue and shortness of breathing, and at last all this combined together will lead to a decrease in lung capacity over time. Now talking of the brain is the command center, and with the decrease in the lung expansion and poor circulation, there will be the oxygen supply to the brain will reduce, leading to less oxygen-rich blood to the brain. Now what happens after this is that you'll have things like brain fog, then you start losing focus, there'll be low energy, and the mood swings and anxiety will start coming in. Now sometimes you're asking yourself, what about the mental burnout? Sometimes the mental burnout that we have is not about the stress alone. Sometimes it's a combination of the stress that we may have and the poor posture starving our brain. Now let's look at how physio will link all this together. Now the purpose of physio is to put your entire posture, entire body into a normal alignment. And by this, some of the goals that we'll have with your physio might include to open the chest and the diaphragm. Now when the chest is opened, you will have an increase in the chest expansion. Number 2, they will retrain the core muscles and the postural muscles. The postural muscles are these muscles that help us maintain our body in a normal alignment, in a normal and natural alignment. The core muscles, basically we talk about the muscles of the trunk and the muscles of the abdomen. Then we'll have improvement in the spinal alignment. That's another goal that you'll have with your physio. Then we have enhanced blood flow and oxygen. That will occur with the stretches and the other physiotherapy interventions that they will be having. Now from today, what can you do? Now, as you are in your workplace, the best thing to do is to start by taking efficient breaks. After 30 minutes of sitting, you should be able to take a break. Then you start with the deep breathing exercises, whereby you train your diaphragm and the breathing muscles to breathe in an efficient way. Then we have strengthening the core and the upper back muscles to just promote the normal alignment that we've talked about. Then you can also see a physio for a personalized plan. But the main thing in this is ergonomics. You can start this by looking at your sitting position. You should be sitting in an upright position with the feet 90 degrees, with your hips and the knees 90 degrees, and then the feet should be flat on the ground, Then, as we summarize, remember that better posture equals better movement. Your body is meant to move, thrive, and be better.